Hello, everybody. Suzanne Kellner-Zinck with Non-Vision Hypnosis here to talk to you about the magic of neuro-linguistic programming, otherwise known as NLP, and the healing of mental health issues, most especially what we would consider emotional trauma. Neuro-linguistic programming was developed by Bandler and Grinder back in the early 1970s, and it was developed by observing some of the best therapists of the day, including Dr. Milton Erickson, who is a psychiatrist as well as a hypnotist, Virginia Satir, who is a family therapist, and Fritz Perls, who is known for Gestalt therapy, among others. Now, the really interesting thing about these techniques are that they're done really quickly, and they're super effective, especially for people who have anxiety. I hear all the time that people have been living with anxiety and they feel like they have to live with it forever. And I'm here to tell you that's not necessary. I help clients get rid of this crap like all the time. Of course, they have to want to be rid of it. And not all clients do want to be rid of their problems, interestingly enough, because they don't know who they are without their problems for whatever reason, and they'll hold on to it. But for those people who are sick of feeling anxious, the people who are sick of being triggered by what other people say, and just want to move on with their lives, neuro-linguistic programming is one of the essential tools in my toolbox that I use along with conventional hypnosis, which I use for deeper work, helping my clients to get rid of inner child problems. You know, when you're walking around and someone's acting like a 5-year-old, even though they look like they're an adult, generally, it's their inner child that is helping to protect them in some way that has outlived its purpose. We help people to get rid of that, as well as to do forgiveness work for the people who they felt harmed them, including themselves, by the way, and to acknowledge and appreciate the people who are there in their lives. I have several clients who can't recall anyone who is there, but with the magic of hypnosis, I'm able to help them find those people, and then they're put on a list to be appreciated, so they know that they were loved and cared for even during those really tough times, especially during those tough times. So what is neuro-linguistic programming? Well, it's a bunch of techniques, and they all use the communication model, which states that we have too much information coming in through our 5 senses for our conscious mind to be able to recall it all. So a lot of it goes into our subconscious mind. It's where we hold our very imperfect memories. It's where we hold our values and our beliefs, which is why they're very difficult to shift unless someone knows how to do that using neuro-linguistic programming. And this information creates what we call in neuro-linguistic programming our internal representation. Now, if I was to ask you to close your eyes for a moment and imagine your mother or your grandmother cooking food that you totally love and you can smell it cooking, you're going to get some feelings arising as a result of that food. And then you're going to taste it. And then you're going to realize that that food isn't just about the food, it's about feeling loved or being taken care of or something like that for most people. That's a positive internal representation. But clients who come to see me have negative internal representations from the traumas that they've experienced, so we want to be able to reframe those. And in so doing, we're able to help folks to shift how they physiologically hold themselves, and most importantly, the thoughts and the behaviors that go along with those internal representations, so they're healthier thoughts and behaviors. So that's basically how it works. And it's a really fun thing to do with clients because they're so amazed how quickly this stuff works. You know, some of my clients have been seeing therapists for weeks, months, years, and sometimes even decades, and they're still feeling really angry, or they're still feeling like they don't know why they can't live a normal life. They don't understand why they're still feeling so depressed. They don't understand why it is that they can't do the stuff that they need to do. They're procrastinating all the time. They just don't understand And although therapy might have given them some insights, they're still having the problems. And that's why someone calls someone like me to help them to release these problems. Now, I use another form of neuro-linguistic programming that was developed by Tad James called timeline therapy. And timeline therapy is a beautiful technique because what it does is, again, it reframes a person's negative emotions into positive emotions by getting their positive learnings off of each of their emotions. We bring them through the very first time they've actually experienced their negative emotion, anger, sadness, fear, guilt, and I usually use shame, especially if addiction of any kind is involved. And they can go back genealogically because sometimes these things go back generationally. They can go into past lives, and as we're told always in our trainings at Tad and Matt James, we don't really care what your conscious mind believes in terms of past lives. We care about what your subconscious mind believes, because it's true. Sometimes those two things are not the same. Or they might have had a memory that came while they were in the fetus or coming out of the fetus. I had a client many years ago who never really met his potential, and what we found out was the reason for that was because he was the second child and he felt guilty for taking his parents' attention off his older brother when he came into life. Pretty fascinating stuff. So it's amazing what people can learn just through going through this process. And limiting beliefs, actually, my clients laugh a lot because in a matter of a few seconds to a couple of minutes on average, they understand that their 5-year-old self or their 4-year-old self or their 7-year-old self had created this limiting belief based on a decision and an emotion they felt at the time. And they're able to reframe it so that they can let go of that limiting belief, knowing that they no longer have to hold it because, well, they're not 5 or 6 or 7 years old anymore. And whatever the learning is that they get from that, they're able to bring that through their timeline to clear that out so they no longer have that limiting belief stopping them from doing whatever it was that they wanted to do. So that is what neuro-linguistic programming is. And if you'd like to have a free consultation regarding the work that I do, either to learn how to do this work with your clients, if you happen to be a mental health provider, or maybe you're a person who did hypnosis and linguistic training before, but you're not getting the results you want. I've trained quite a few people, or actually retrained them because they didn't get the results they needed, nor do they know how to screen out people that really weren't good, shall we say, clients for hypnosis, because it's not for everybody, you know. It's really for people who are ready to heal right now, and it's also not for people who have an IQ less than 70 because they can't focus on what we're doing, and it's not for people who have personality disorders. I have worked with a few people who have some of the symptoms of personality disorders and helped them heal the issues that were in their way. But if they had full-blown personality disorders, these folks have a really hard time gaining anything from any kind of treatment as far as I'm concerned. I was raised by one. I did a lot of work actually with my mother. She loved to be hypnotized. And I did it with her for pain control as well as anxiety. And it worked to the degree that it worked with her. It was fun to do it when she was in the mood to have it done. Interestingly enough, every time we'd go to do it, one of her cats would jump on her and she'd be laughing completely and totally. But I just talked through it and we were able to help her get the stuff done that needed to be done, including creating a recording for her. She had some skin cancer that needed to be removed, and her doctor told her that he was not going to deal with a hysterical patient because she was freaking out when she knew what had to happen, and she was a model patient. The surgeon couldn't believe it, but that's what can be done. So I hope that this inspired you a bit to learn more about it and maybe how you can get rid of your problems that have been holding you back for months, years, decades in some cases, quickly and effectively. And as I said, you will find all the information on how to book an appointment with me on my calendar. in the post below, and you can donate to help me to continue creating these videos for you guys by buying me a coffee, which is at the very bottom of the listing. And as always, I thank you for being with me. Till next time. Bye-bye.